The Betty Puskar Breast Care Center sees, on average, 80 patients a day. If you cannot come to the Betty Puskar Breast Care Center, we have a wonderful program called Bonnie's Bus, which travels around the state of West Virginia, offering mammograms to those who cannot come to Morgantown. Our center is made to be warm, cozy, and welcoming. It is our hope to make your visit with us as relaxing as possible. We have over 40 cancer physicians, more than 70 Mary Bab Randolph Cancer Center support staff, and 112 Cancer Center researchers. I am standing here in our newly remodeled waiting room that was made possible by your contributions. This is the starting point of our trip behind the scene of the center. In a few minutes, we hope to show you what makes the Betty Puskar Breast Care Center a very special place in north central West Virginia.
I'm Dr. Michael Hogan, a radiologist here at the Betty Puskar Breast Care Center. And why should a woman come here for her mammogram? We have a newly renovated, state-of-the-art facility. Our entire staff is very dedicated and very well trained. The radiologists are all board certified and spend almost all their time reading mammograms. Everyone works very hard here to make it a very pleasant experience for every woman who comes through here.
This is one of our digital mammography units where your images are acquired. Note the pink pad on the imaging surface that is the mammo pad that is there for your comfort. This is a radiologist reading area where your films are interpreted by our highly trained physicians. This is our stereotactic breast biopsy suite. We are one of only 3 American College of Radiology accredited facilities in West Virginia in this specialty. Hello, my name is Barbara Minier, and I am the manager of the Betty Puskar Breast Care Center and the Bonnie Wells Wilson Mobile Mammography Program. When you come to us for your initial screening mammogram, you can expect to be greeted and we'll ask you some basic questions. The mammographer will come out and greet you and escort you to a room where some breast health questions will be asked. At that point, we will start your actual mammogram imaging. A mammogram consists of 4 basic images, and we will reposition you in 4 different ways. Your breast will be compressed and it will be tight, but it will only be for a minute. This allows the radiologist to distinguish between your breast tissue. We may also take some additional images while you are here, and that will be just to make sure that we have included all of your breast tissue. Here at the Breast Care Center, we use mammo pads, and those are provided for your comfort. They provide a softer surface for your breast, and it is also warmer. The recommendations for having a screening mammogram are to have your baseline, which is your very first mammogram, between the age of 35 and 40. After 40, the recommendation is to have a mammogram every year. Here at our facility, we can match you with alternate methods of payment to put breast treatment within the reach of all patients. On behalf of the Betty Puskar Breast Care Center, we would be proud and honored to take care of any of your treatment needs. And thank you for all of your contributions and support.
Throughout the center, we have a lot of the P. Buckley Moss prints that was donated, mostly by my family and some by friends, but they were donated because it's such a warm feeling and they're very family oriented. And we just thought it would make the patients feel better while they're waiting on their mammogram. And we have had a lot of replies, and they're all positive that they do enjoy the prints on the walls.
My name is James Abraham. I'm one of the cancer doctors at Mary Bab Randolph Cancer Center. I'm the Chief of Oncology and the Medical Director for the Cancer Center. I specialize in breast cancer. So over the past 10 years or so, I've been treating breast cancer at Mary Bab Randolph Cancer Center and the Betty Puskar Breast Care Center. As you know, about 200,000 women will get a diagnosis of breast cancer in 2010. And about 40,000 will die from this diagnosis. But over the past 10 years or so, the number of people dying from breast cancer is decreasing steadily. One of the main reasons is at places like Betty Puskar Breast Care Center, where we do screening and early detection. And as you know, early detection of cancer is extremely important to treat or cure those patients. Few unique things about these places are, of course, Betty Puskar Breast Care Center is probably one of the most patient-centered, patient-focused programs at the hospital or at the cancer center. So here, let's just say somebody get a diagnosis of breast cancer. We have a team of doctors who can take care of that person. So as soon as a person gets a diagnosis of breast cancer, the patient is seen by the nurses at the Betty Puskar Breast Care Center. They explain the diagnosis. Then the patient is plugged into a cancer center clinic, where in 3 or 4 days later the diagnosis, the patient will be seen by a medical oncologist like me, or a surgeon like Dr. Hassett, another medical oncologist like Dr. Kurian, or radiation oncology or genetic counselor. So we have a team of people working together to take care of this patient. And as you know, the treatment of breast cancer is extremely complicated. It's not just one person making the decision. So we have the pathologist helping us, we have the radiologist helping us, and we have a group of genetic counselors, nurses, and social workers helping us in making the decision and the treatment plan. When a person gets a diagnosis of breast cancer, or for that matter any cancer, it's not just that one person is affected, it's actually the whole family is affected, or the community which is surrounding that person is affected. So we have American Cancer Society volunteers coming in, and we have social workers talking to them. So we try to put as much support for that person to get through this tough diagnosis and treatment. For sometimes the treatment may last for 4 to 6 months, or sometimes more than a year. So we try to bring a patient-focused approach as much as possible at this situation. So as you know, the diagnosis and the treatment of breast cancer or any cancer is extremely complicated and it's costly, and we really appreciate the support from Betty Puskar and all of you in making that less painful for our patients. And I thank you for attending this fashion show.
Welcome to the show. I hope it's to your liking. Get comfortable. The curtain is rising. I step onto the stage. Nervous anticipation. I'm so glad to see you here. There's no way to describe it. I'm for the mic, two for the show. Get ready before it goes. Welcome to the show.
5, 4, 3, 2, 1.